Good afternoon, everyone. Thank you for joining us in today's webinar where we're going to discuss a career in healthcare. I won't spend too much time talking because we have some amazing guests who are going to introduce themselves. But just to start, I'll introduce myself. My name is Melissa Hippolyte. I'm the Director of Strategic Partnerships at the CollegeBound Foundation. And here I have my colleague, Cameron Fear. Cam, please take a second and introduce yourself.
Hello, I am Cameron Fear, and I am a college completion advisor, and I work specifically with students at Towson, UMES, and Salisbury. And I'm going to be monitoring questions today and making sure that our panelists get those questions. So if you have any questions, feel free to put them. It's a webinar, so not in the chat, but you can do the Q&A, and I'll be monitoring that to make sure that our panelists get those questions.
Awesome. Thank you, Cameron. And I guess we can just get right into it. These recordings, because we have them on the first Wednesday of every month, these recordings, if you're able to join, amazing. We have some really good content, really good topics. They live on the CollegeBound site. So Cameron can drop that link in, I keep saying the chat, but he's going to drop that link for you so you can see where to go to view the other ones. We did one on brand building, interview questions. I think the last one we did was a career in STEM. Today we're talking about healthcare. Next week we're going to talk about business and entrepreneurship. So just to kick it off, I will give our wonderful panelists, we had a chance to chat before we started, a second to introduce themselves. And I'll start off with Nadia.
Oh, sure. Hi, everyone. My name is Nadia Fobbs, and I am currently a registered nurse at Johns Hopkins. I've been with Johns Hopkins for the past 25 years, working in women's health. And I just recently, I would say within the last 5 years, transitioned from inpatient to outpatient. So yeah, that's what I do on a daily basis. And as this speaker series continues, we'll get into a little bit more details about specifically what I do on a daily basis.
Okay, thank you. Damien?
So Damian Myers, I am a physician by trade. In 2010, I started practicing medicine and went into medical education. Founded a biomedical program, taught and ran a biomedical program at Western High School for 7 years. And now I am the co-founder of Med Reimagine. Essentially, what I've been doing since 2010 is cultivating the first ever national pipeline of aspiring Black and Brown doctors. So we do summer camps, science curriculum, and we are a credit-bearing elective in 2 school districts. So we work with kids beginning in 5th grade all the way through high school, through college, until they get into medical school. So that's me and what I do in a nutshell.
Awesome. Thank you. Jeanette?
Hi, I'm Jeanette Gibbs. I am the Senior Vice President for Ambulatory Services at University of Maryland Medical Center. I just changed jobs. That's why I have to correct myself. I just started here just a few weeks ago, and I was in a similar position in Pennsylvania. So that's why I stuttered a little bit when I said University of Maryland. What my role entails is I have oversight of all of our doctors' offices for the University of Maryland Medical Center. I make sure that we are doing what we need to do to see the patients of our community and get the care they need.
Awesome. I'm excited about this one. You guys have so much to offer, and I'm lucky to know you all. And I'm sure with these sessions, I always learn things that I don't know. So Nadia, tell me about your college path to where you are now, like where you studied, if you were part of any professional organizations, anything like that got you to the point that you're at now.
Certainly. So when I first moved to the US almost 30 years ago now, to pursue my dream in nursing, I initially ended in California, which ultimately didn't work out. Moved here to Maryland to be closer to my brother and his wife, and started pursuing my dream of becoming a registered nurse. So I ultimately graduated from Notre Dame of Maryland University with my bachelor's in nursing. I continue to be a part of the A1, which is the Association of Women's Health, Obstetric and Neonatal Nursing. That's pretty much my focus. It has been for the last 20 plus years as I've been in this career. Maternal child health has been my love. I did labor and delivery, bringing babies, lots of babies into the world. And now with me being in an outpatient setting, I still have my hands with the babies after they're out. I do a little bit of field testing though, in clinic on a daily basis, and just helping moms like navigate their care from a prenatal perspective, getting them registered and getting them the care that they need, in whatever capacity that is. So yeah, I love what I do. I continue to love what I do. And like I said, nursing has always been a dream of mine, and I feel like I'm living my dream every day.
Okay. And undergrad, did you mention what college you went to?
Notre Dame of Maryland.
Notre Dame of Maryland.
Yes.
Awesome. Because I know
I'm currently pursuing a master's in informatics, just to help with the Epic side of things. Ultimately, kind of branching the outpatient, EMR, kind of like establishing a better understanding of kind of merging our systems, so to speak. Like if a patient goes, let's say, to Patients First, or any other outpatient setting, we're able to kind of see where they've been and what they've been doing, and it helps to facilitate better care essentially for our patients, because we're able to bring all of that together. So that's a focus of mine as well.
Awesome. Thank you. Our audience is typically college students and high school students. And we do these because we want them to kind of think broader and realize that there are different aspects of healthcare than maybe that they already see every day. So that's what, some of the questions I'll ask you guys to maybe say more about that or dig into that a little bit more. Okay, so Damien, can you share with us your path to where you are now?
Sure. So proud graduate of Morehouse College in Atlanta, Georgia. I was a biology major. From there, I went on to UAB in Birmingham, Alabama. I got my master's in public health epidemiology, did some research at the Center for Disease Control in Atlanta, and then matriculated up to medical school at Wright State University in Dayton, Ohio. So I'm an MD, MPH. And now I don't practice, but I use my knowledge to really cultivate the next generation of healthcare professionals. And so it allows me to be very detailed in my curriculum in terms of knowing exactly what students need to know to get through the hurdles that lie ahead. And so although I don't practice anymore, I still very much consider myself to be a clinician, as well as an educator now. And I really love entrepreneurship. And so even with my children, when I talk to them about careers, I tell them, I don't care what you go into, follow your passion, but think about ways that you can be innovative. Think about gaps that you may be able to address and own your own business, because the flexibility and just the pride you have in building something, you really can't put a price tag on that. And if you do it right, there's a hefty price tag. So I like that fact as well.
Awesome. And Jeanette, how did you get to where you are now?
So I went to University of Maryland, Baltimore County for my undergraduate degree, and I studied biology. I was pre-med when I first started out. So that all the classes that are associated with being a physician that you take in undergrad has really helped shape my career in some ways, because I understand some of the biology side of and the chemistry side of medicine. And then I went to University of Maryland College Park for my graduate degree. Along my career, I worked in healthcare all the way since I was in middle school, and so it was natural for me to be in this role. I did think I was going to be a physician at some point in my life, but quickly realized that administration and management was more my expertise.
Okay. Now, kind of on that same topic, Nadia and Damien, Jeanette, I'm feeling like you thought maybe I was going to be a doctor, and then you said that you kind of branched off. Nadia and Damien, did you guys always know that you would be where you are now and be doing what you thought you'd be doing now?
For me, absolutely. I feel like I've been called to be a nurse. I distinctly remember walking in the backyard of my house. My grandparents, they would come and visit on the weekends. And I remember my grandmother saying to me, "So what do you want to be when you grow up?" And I was probably about 10 or 11 years old. And I said, "I want to be a nurse that takes care of babies." And that just sat with me, through my years of high school. And then, when I decided to come abroad to further my education, I just knew that's what I was going to college to become a nurse. And then once I graduated, the opportunity presented itself at that time for me to go straight into labor and delivery. Typically, they would like nurses to have at least a year in like med-surg nursing, but there was such a huge shortage at that time that they were just grappling for nurses everywhere. So I kind of locked out. So I applied, and of course they took me in, and 8 weeks after a very intense orientation, I did labor and delivery, and like I said, I stuck with that for a full 20 years. And I don't have any regrets. If I had to do it all over again, I would take the same path.
Awesome. Thank you. Damien.
I don't know if I knew exactly what the role would look like. I've had, it seems like 3 different lives, but everything that I did led to this point. And so I do feel like my steps were almost ordered. If I hadn't gone through the medical pipeline, and experienced some of those challenges that every student faces becoming a doctor, I don't think that I'd be able to look students in the eye and tell them how hot the fire is, and also tell them, but you can get through it, and here's how you're going to do it. And so, school was really easy for me, quite honestly. I'd never really been challenged. I was a straight A student who kind of just breezed through. I guess I always kind of was academically inclined and liked to learn things of that nature, but I was an athlete, played college basketball, all of that. And so I wasn't really thinking so much about becoming a doctor as I was realizing that where I'm originally from in Detroit, Michigan, kids don't become doctors. And so as I started going through the pathway, I realized like, oh, there are barriers here that keep kids that don't come from rich families or families with a bunch of doctors and nurses and those that really understand the pathway. If you don't have that, it's very hard for you to get through this gauntlet. And so I always wanted to help. And so I started out working as a physician and mentoring, and I wasn't really making the impact that I wanted to make. And when I went to medical school, I was the only American-born Black male in my class, and I started asking why. So I feel like everything that I went through, everything that I experienced, it led me to this point. And now when I have students who want to become doctors, nurses, public health professionals, engineers, it doesn't matter. I'm able to really help them devise a solid plan, understand the challenges that they will face, and prep them so that they can get through whatever hurdles may come their way.
Okay. On that same note, you guys, what are some pointers then that you would give to students if we had some high school students watching? What would you tell the high school students who maybe want to get into healthcare and they're in high school figuring out? What advice would you guys give to them?
I'll start. So I think one of the things that I'll say to a high school student is don't feel that you have to proclaim what you want to be for the rest of your life in your freshman year. You may change, and that's okay. I believe that a lot of kids might understand what area they want to be in, where they want to focus, but that might change just slightly over the years that you're in college. Myself, for example, of course, yes, I was pre-med, but then I changed. Then I graduated my biology degree and never applied to med school. I decided to go into administration instead, and I thought that, and I'm glad, because at this point in my life, I help support the physicians and the nurses that I work with to do the things that they're passionate about, and I love that. I am part of that care continuum. I'm part of helping to make sure that our patients, our community, are getting the care that they need. And so, again, give you the advice of don't be too hard on yourself in your freshman year or in your sophomore year, maybe even, of this is what I am supposed to do, because that might change. You find your passion, you figure that out along the way, and you go with that at that point.
Awesome. Anyone else like to share?
Well, I would say, find me and my company because it literally is what I do for a living. We work with kids starting as early as 5th grade. And we teach you, we focus on what we call the 3 Ps: physiology, how the human body system works. So if we're talking about the cardiovascular system, how does the heart work? What does it do? How does it function? And then we look at pathology. What are the 10 to 20 things that tend to go wrong with the cardiovascular system? And then we bring in pharmacology and medical interventions. How do you fix that problem? So if you have an interest in going into any aspect of healthcare, we have summer programs. I have a program right now at the public library where Nadia's daughter, who is a college student, is actually working for me, earning a little bit of money. And so it's literally what my company Med Reimagine does. And so I'm always looking for students that have the interest in going into healthcare, and then we can figure out an individualized plan that will work for you and expose you hopefully to enough areas of healthcare that you can figure out your sweet spot and what you like. Because a lot of times all students really know is doctors and nurses, and there's so much more. Healthcare administration, you know, as was spoken about earlier, like there's so many different things you can do. So I tell students all the time, if you don't like blood, you can do public health and never see a patient. You know, I have a master's degree in public health. And so I would just tell them, you know, there are people out there that can assist them in this journey. You don't have to figure it out on your own. And if you have the drive and the passion, we can figure out the rest.
Awesome.
Absolutely. I'll say just a spin-off of, you know, Damien's program. So my youngest daughter, she's also a part of the program, but she's a student, right? And she wants to be a vet when she grows up. And this is like the perfect opportunity for her. And she's having so much fun with it. With dissections, I think, are coming up, and just learning about the cardiovascular system. And she's excited. Like, you know, it really triggers in her that excitement, and it keeps it going for her. And I think with all that experience that she's getting along the way will eventually lead her on the path that she wants to take. You know, knowledge is great. Just knowing, you know, just what you want to do, even if you don't know what you want to do, just having that exposure, you know, it doesn't go to waste. It essentially just kind of helps you to be exposed to it and learn things. And then for some people, I mean, even with the exposure, they may say, oh, I thought this is what it was going to be. And then it turns out that it's not really something that they want. So just, you know, take your journey and go with it, and take away from it as you will, and let it serve you along the way. You know, life is a journey, right? So it's never wasted, and you can apply what you've learned to anything. Like you said, you know, Damien, like you were saying, you don't necessarily have to become a doctor. You know, you can never see a patient if you don't want to, but it's knowledge, and it's great.
Okay. Speaking of that, Nadia, what do you do every day? So what's your typical day like?
So every day looks very different for me. So, you know, one day I might come in and just do a bunch of triages. So I have like a portal, and the messages come into the nurses. Since it's outpatient, nothing here is, I would say, like a 911. It's not urgent, right? It might be a little more pressing, something that needs to be answered within like 24 hours. But ideally, if it's something that is pressing, we would then refer them to either urgent care or emergency room, or for the pregnant patients, you know, send them to labor and delivery. Or another day, I might be working on prior authorizations for much needed medications that patients need. We have fetal testing days for patients that are more high risk that need to be monitored. We have a fetal testing center here. So sometimes I would run the fetal testing center, which includes like ultrasounds and non-stress tests. And then I'll work along with the maternal fetal medicine doctors to kind of report off to them. I do enjoy that part of it because it gives me a little bit more of what I used to do in the hospital, you know, and bonding with your patient, listening to the babies and things like that. And then some days, if there are not enough medical assistants, because there, you know, we are a little short staffed, sometimes you kind of fill in with the providers and you room the patients. I see Jeanette like shaking her head because she understands exactly what I'm talking about. And that too is not, I kind of like that side of it because it gives me that bedside experience that I no longer have working in inpatient. So it's very interesting. I love what I do. And then one day of the week, I get to work from home. So I would get into my in-basket portal and I would do messages, triaging patients, doing prescription requests, maybe doing some prior authorizations for medications, things like that. So it gives me, you know, a little bit of a avenue back from being in the office, which is nice because I can just work from home, get up in the morning, slip on, you know, my jammies, get a cup of coffee and just work from my computer. And then it gives me a little more flexibility to, you know, attend to the kids or do something in the house or something like that. And that's all with a nursing degree. So you don't always have to be in the hospital, you know?
So for the students watching that don't know some of these terms, please describe triaging.
Okay, great. So let's say, for example, someone sends a message in and this is a pregnant patient because we see obstetric patients. We also see just GYN patients or somebody like needing like annual exam or something like that. But let's say it's an obstetric patient who messages in and says something to the effect like, you know, I'm kind of worried. I have not felt my baby move in the last couple of hours. This doesn't necessarily feel like, you know, what my baby normally does. And I'm concerned. So what I would then do is I will pick the phone up and I will, you know, talk to the patient essentially. Okay, first of all, I'll go through the chart, see maybe how many weeks they are. Should they be feeling fetal movement? You know, at 10 weeks, you're not going to feel fetal movement. You're not even at 16 weeks, you don't feel fetal movement. But let's say the baby's what we call viable. So somebody that's a baby that's 24 weeks in utero or greater, you should be feeling rhythmic movements on a daily basis. And I would just say to the patient, okay, so when was the last time you felt the baby move? And she may say something like, well, last night. Okay, have you eaten breakfast this morning? Yes, I did eat breakfast. Did you drink something sweet? Maybe some orange juice or something. Still haven't felt the baby move? And if she says, yeah, I still haven't felt the baby move, then it's time for you to then reroute that patient to labor and delivery for further assessment and fetal monitoring. So that's just one of the more like pressing, I should say, triage patients. Then you might have someone just messaging, hey, I'm out of my birth control pills. I'm on my last pack. Can I get a refill? So something like that, I wouldn't need to call, but I will then do like a prescription refill request and then forward that on over to the provider. And then the provider picks that message up at the end of the day and sends the prescription refill to the patient's pharmacy. Then send me a little message saying, hey, I did send that prescription refill to that patient. Can you just let her know? So it can go anywhere from, you know, something more pressing to something not quite as pressing. And so for the pressing messages, we have to answer within 24 hours, the non-pressing 72 hours.
Okay. So you're telling me there's no such thing as typical in your world. Who knows what's going to happen? It's based on whatever the patient says or
Correct.
what happens on that day. Okay. Does a full moon, is it like in the schools where the full moon kind of affects what happens in the office?
Sometimes, believe it or not, there's a trend for that week. For whatever reason, like when we were in the hospital too, somebody's coming in, everybody's coming in with their bag of water broken and everybody's getting admitted and all our rooms are full, right?
Oh, man.
So then in the clinic, we'll have like a theme, so to speak. Everybody's got high blood pressures. Everybody's worried about their headaches. Everybody, you know what I'm saying? And yeah, that sometimes can be determined by, oh, is it a full moon? Because people are really kind of acting, you know, a little bit more than normal. Yeah, what's going on?
Okay, good to know.
There's
So
some truth to that.
for the people listening, this is some of the things that you can prepare for as you get into a career in healthcare. Damien, what's a typical day like for you? Which life am I referring to, right? So yeah.
So I almost feel like I'm on the wrong week because at this point, you know, I'm an entrepreneur. By and large, you know, I'm the chief medical officer, a co-founder. And so my day normally revolves around the business of the business more so than working with the students on the ground. My job is to make sure that the funds are coming in, that we are fiscally responsible, and that my team has everything they need to be successful. So I make sure that I set them up for success, because if things are not right, they know I'm coming. So I tell them all the time, if you see me, it's a problem. Things aren't right. If you don't see me, that's a good thing. And so it just varies. So this morning I was on the phone for 2 hours with the consultant in Michigan who we hired because there's an opportunity for us to get probably somewhere between 500,000 and $1 million in contracts. Yesterday, I was on the phone for an hour with the superintendent up there for the same reason. I spent the majority of my afternoon getting documents together for the accounting firm because, you know, it's tax season and we had to make sure the W-9s are checking out and they had a couple of questions. And so this afternoon, I'll be daddy for a couple of hours. You know, I have an 11-year-old and a soon to be 13-year-old. So that's my most important day. So I always carve out time for my children in late afternoon when they get out of school. And then I'll be right back at it. I need to review a slide deck because I'm giving a presentation. I was in Atlanta last week talking to individuals at Morehouse School of Medicine. And next week, I think I'll be up in New York. And so I like it. I don't like monotony. I don't like, you know, every day I get up at 9 o'clock, at 9:15, I put on a crisp white shirt with a blue tie and go to work. I kind of like the grind of it. And I love entrepreneurship. One thing that we have not touched on collectively is the importance of having representation in medicine. And so I never take my job and what I'm doing lightly because I recognize that the shortage of Black and brown healthcare workers we have in general literally means life and death to patients in certain populations that don't have access to go wherever and get the best whatever. So if you don't have really, really informed clinicians who care about you, it is very easy for folks that, you know, may not be the most educated or the most comfortable in the hospital setting to slip through the cracks. And so I'm happy to be here and see the representation we have in different facets of medicine, but my days are all crazy and I wouldn't change them for anything because I love building.
Awesome. Awesome. Thank you for that. I don't know, Jeanette, how you're going to go after that. Especially since you've been
I got this. So first of all, I do want to say, Damien, I totally agree with that mentorship. So I pride myself in being a diverse member of the management, of the senior management at the University of Maryland Medical System, because a lot of the staff that are here look like me, and now they have someone that they can look up to and reach out to. And I pride myself in that. I take it seriously. And so it is something, I love being a mentor to the younger me's so that I can help them get to where they want to be. I can help them be me someday and help them and talk to them about my path. My typical day, so because of my level, I make a lot of decisions every single day. And so my day is mostly filled with meetings, back to back meetings, a lot of knowledge transfer, a lot of mentorship, a lot of guidance to my direct reports or my peers across the organization. And so, yeah, it may sound boring, but I'm never ever bored during my day in my meetings. Every once in a while, I get to have some fun, I call it, and I go and do pop-ins at some of my doctor's offices, and I talk to the staff, or I sit in the waiting room and talk to patients, or I talk to some of my physicians or my nurse practitioners and ask them what's going on, what can I do to help support them, help them see patients, see more patients, or what do they need, and that's fun to me. In my last organization, I actually got trained on our electronic health record, and I would sit at front desks and check patients in sometimes. And the staff that would work with me, that would be working at the same time as me, they were all nervous the entire time. But I was like, you're my teachers at that time. And so it's always fun to do things like that for me. I've done a little bit of everything in my career path to get to where I am. Before medical assistants had to be certified, I was a medical assistant. So I helped triage patients as well. Would I ever try to draw blood today? Nah. But I could do it. And anytime I go to my doctors myself and get blood drawn, I'm sitting there watching. And I'm like, no, it's that.
I'm the same.
So yeah, but I love where I am. I like what I'm doing. I have a little bit of an A-type personality, and so I kind of am a boss. Hey, Melissa, I saw that face. I like leading people, and yeah, it's fun to me. So
What would you say contributes to your professional success? Jeanette, since you're talking, might as well. What do you think? What do you think?
I'll say the young me first. When I first started getting into healthcare and then healthcare administration or desk work in healthcare, for me, it was not staying in my lane. I got to know my job. I got to do my job very well, but then I also learned the job of the person next to me on either side and the person down the hall too. I volunteered for committees, volunteered for projects, and just learned everything I could after doing my job really good, of course. And that was fun. It got me exposure to other people in the organization. It put my name out there as someone that was eager to learn, but also smart. And so that's one part of how I got to where I am today. I think in today's day, number one, I'm very decisive. I can easily make a decision. I can see the path. I can see data. I can analyze that data in my head and see where the problems are in the process or the workflow. But then also being the leader that I am an engaged leader. I want to know my staff. I want to know my managers. I want to know my physicians. I want to talk to them. And because of that, they respect me. And having that respect in my organization is key to being successful.
Awesome. Thank you for that. Nadia, Damien?
I would say keep learning. Sign up, spin off of Jeanette, just sign up for, committees, work on projects, expose yourself. Don't be afraid to go back to school. I know I'm going back to school a little bit later in life, to get a graduate degree. Just did the mommy thing for kids, wanted to make sure that they were good, and now I feel like I can give back to myself and now I've been in this field for quite some time, right? So now I can say, okay, what would be something I would like to add to my resume? I've seen the inside of patient care. I've seen now the outpatient side of things, and how do you bring it all together? So keep advancing that career, advancing that degree. Network. I would say when you go to events, rub shoulders with people who are in different departments, kind of talk to them, figure out what they do and, what got them there. And, they may invite you to something that, they're hosting, some type of event or something like that. And, go be a part of it, see what it's about. It may be something that might interest you. You just never know. And that's what you do as a team, right? You keep each other in your circle, and you learn from each other, and that's how you grow, and that's how you develop, and that's how you continue to stay relevant, so to speak. And it's not a bad thing. It's a good thing, because at the end of the day, we all depend on each other to do our jobs in one way or the other. And that's what I would say contributes to my professional success. And I would recommend that for, the young ones coming up, behind us.
Damien, anything to add?
Yeah, I love everything that was said previously, and I definitely agree. I'm a worker bee, and so I just outwork the competition. I have a treadmill mentality. If you get on the treadmill next to me, I'm not stopping until you stop. And so that has really gotten me far in life. I don't know if I want to use the term born leader, but I've been captain of every team I've ever been on. And with that comes a lot of responsibility. And I've always been comfortable being a leader, because I knew when other people were sleeping and goofing off, I was putting in the work. So I still, to this day, do 2 audiobooks a week. I can't read like I used to because I'm getting old and those little words. And so audiobook makes it convenient for me. So one is normally a pleasure book, normally something about sports. and one is something that's going to help me personally and professionally. And so every week I try to knock 2 out and I alternate between them. And I feel like as a leader, because I put the work in, I am in a position to make the informed decision. So I take into account what my team has to say. You know, I'm also very aware of what I'm not good at, and I'm okay delegating and saying, okay, you have more experience, you've done this before, tell me what you think, or let's go that way. And I'm kind of the same way, you know, even in my personal life, you know, at home, you know, there's definitely things that I tell my wife, you don't want me touching that. You go handle that. I trust you. Just let me stay over here where my sweet spot is. And I think the desire to really control my own destiny really played a key part in my success, where early on I had the worst jobs that students could have. You know, I sold Kirby vacuum cleaners door to door, Royal Prestige cookware, you know, I was a paper boy, and I didn't like the culture of the organizations. And so I think I was determined to one day get my own shop and I could kind of set the culture. So we have a, you know, my employees, they don't ever want to leave. You know, we have a great culture. Everybody wants to come to work. We're a family. So we're really intentional about who we allow to come into our family. And again, just understanding that I could control my own destiny. So on Fridays, if I want to play golf, I go play golf. Every month I get on a plane and go somewhere to clear my mind. And those are the fruits of many years of labor, but always kind of like working towards that. And ambition is a tunnel that has no ending. So if you're ambitious, it's not going to end. And so just realizing that and just being willing to sacrifice, you know, and put in the work. I sacrificed my 20s. I barely remember my 20s because it was medical school, residency, all of that. And so now I tell my kids, yeah, you see daddy traveling, going to play golf, but please understand that, you know, when I was young, I paid my dues. And I think I tell students all the time, it gets greater later. You're either going to work hard the next 6 to 8 years of your life, or you're going to work hard the next 60 to 80 years of your life doing something that you probably don't enjoy. So put the work in while you're young. You have the energy, you have the drive, and you have, you know, endless possibilities in terms of your career and both professionally and personally.
Okay, very well said. So I hear this word a lot in these sessions, right? Regardless of what we're talking about. We did one on interviewing and job skills. Now we're talking about healthcare, and everyone mentions networking and mentorship. Everyone mentions that. Where, and I always ask the same question, where did you find your mentor? How can students find mentorship? And how do people network? That's 3 questions. I know it's a lot. Pick one and go with it, please.
In your workplace. I mean, wherever you work, right? You might not necessarily be in your career, but you're working your way up to your career. There's going to be somebody that will be willing to kind of take you under their wing and show you the ropes and kind of teach you the ways, you know? So, and go to events and, you know, join committees and, you know, do things that are appealing to you, and the mentorship will come. You know, I remember in my earlies, actually, when I was on campus, I was looking for a summer job, and I was already like on campus tutoring disabled students, English, and there was a counselor there who he was running like this internship program through Hopkins. And, you know, just from hearing conversations in the office, he's like, hey, would you be interested in like doing a summer internship at Hopkins? And this was well before I even like thought that I would be a nurse at Hopkins. I know I would be a nurse, but I didn't know I'd be a nurse at Hopkins. And I got to say, thankfully, you know, I kind of just went with that offer because it was a paid offer. It was $2,500 for the full 2 months. I did my summer classes on campus, and then I would go over to the Hopkins campus and I would, you know, meet with other girls and boys that were interested in pursuing a degree in a health field. And the only requirement that I had was to present at the end of that 2-month internship, right? Stuff that I had learned. And I gotta say, that was the ticket to me getting in the door with Hopkins. Because once I did that internship, somebody there fell in love with me and my work ethic and yada, yada. And then they offered me a weekend position, just working at the National Institute of Drug Abuse. And so I had a little weekend gig going. And then those nurses, they essentially kind of fell in love with me. And by this point now I was in my nursing classes and they were like, hey, you're in-house. So when you graduate, you can apply like internally for labor and delivery if that's something you want. And they showed me the ropes and it just kind of just all unfolded in front of me. So people will be there along the way. We're not alone in this world, right? And it will come. That networking will come, that mentorship will come, and just go with it.
Huh. Because we're helping students now find internships and job options. So I knew that internships could potentially turn into jobs, but I never connected that when they apply, they'll then be an in-house applicant. So then it's absolutely easier.
Yes, ma'am.
Okay.
Yes. And they look at the internal applicants before they open up the pool to the outside applicants. So you actually have a little in, you know what I mean? Because you're already on payroll, okay? Because you're getting paid as an intern and they can already speak for your work ethic, right? And, you get familiar with a lot of the staff and they can kind of vouch for you. Like, hey, she was here for 2 months. We loved her. She did great. She would be an excellent asset to our staff. And that's what HR wants to hear, right? It's less of a risk for them because they know, okay, this person's been here. They love it. We know that they're just not going to get trained and leave. Like they're here for the long haul. So like, why not offer them a job? It's a little bit less of an orientation, and orientation, as we know, is very expensive, right, Jeanette?
Yes.
You bring people on board and you pay for this long, extensive orientation, and then they leave. So by being in-house, it's a win-win for them and for you, because you don't have to go through as long of a channel because you're already kind of like in their system. So it's absolutely a great avenue for students to channel their way through, like get a little part-time job, working at the hospital, if that's where you want to be, and that's how you network.
Awesome. Thank you. Damien, Jeanette, anything to add?
Yeah. And I know you mentioned earlier, the audience is typically high school and college students.
And my mom.
I think there's two different skill sets or things that you can do. Yeah, that's funny. For high school students, I would say make sure that your teachers know who you are and you're more than the grade that is on a test. So, and the same with college professors. Like if you're in high school, eventually you're going to need a letter of recommendation if you aspire to go on to college. If you're in college and you want to go to medical school, grad school, what have you, if you want to get an internship, your college professors, it helps if they know who you are, or else they're going to write a very generic letter. But if they get a chance to know you, like when I was in college, professors have office hours. I would go towards the beginning of the semester when I was taking the class and take 5 minutes. Damian Myers, I just want you to know who I am. Don't anticipate having any problems, but if you see there's a problem, come to me. Let me know if I'm slipping or whatever. And I would make a joke out of it, but then they know who I am. And by doing that, and I did good work in one class, it led to an internship, like to what Nadia is saying, where the teacher came to me and I took a class in public health my last semester of college just because I needed to take some sort of science course to graduate. I was, already admitted to medical school. I was fine. And the professors came to me and said, you're doing really well. And I was taking a course that they combined with Morehouse School of Medicine. He's like, your grade is better than most of my grad students. Do you like this? Yeah, I like it. Would you like an internship? And I'm like, where? At the CDC. And I'm like, do you know someone? And he starts laughing. He's like, I lead a division. I teach here as an adjunct. And I had no idea. And that turned into not only a summer position, but he was able to write letters of recommendation for me until his dying day. And so you just never know who's watching. As you get older, like literally you can go on Eventbrite and you can see a number of events that they're having in Baltimore all of the time. My wife can tell you about half of them because she's always going. And so really figuring out also under what environment do you feel comfortable? Like I am not the type to go to a conference and network with everyone. I become more of an introvert. But if I go to a cigar lounge or somewhere that I'm comfortable and I'm around people in a relaxed environment, I'll talk your head off. And so I've been able to just make meaningful friendships. And we were talking a little bit earlier about the golf group. That's kind of how it happens. And we support one another. If you are a good person and you help people, even when they don't ask, and you expect nothing in return, the blessings that you receive in return and the number of people that will be willing to move heaven and earth to help you in whatever endeavor, like they all work hand in hand. So just be a good person and be willing to, reach out and maybe make the first, statement in terms of starting a conversation.
Mm-hmm.
True.
So Damien stole a lot of my thunder. So I'll just say a couple things. I've broken out of it in my as I've gotten older, but I used to be a severe introvert, very, very shy, never wanted to talk to anybody. But I will mention this, what happened, what I did, and was sweating the entire time. But I worked while I was at Western High School. I worked for us in the summer at a law firm in the mailroom downtown, a very large law firm. And one day I just happened to be on the same elevator as one of the named partners. So one of the people who was on the outside, name is on the outside of the building. And I introduced myself. I said, "Hi, I'm Jeanette Gibbs. I am one of your student interns. I work in the mailroom." And he started talking to me. And he asked me to ride the elevator up all the way to the top floor. And I did. And I talked to him a little bit about myself and what my career interests were. And of course, I said I wanted to be a lawyer, but and he was one of the people who wrote a recommendation letter for college for me. And, I saw him a couple more times, but he was just so generous to me. He looked very mean and scary, but he was generous. And so you never know. So when you're in internships, you can potentially find a friend in some of the leaders that are there. And the other thing I'll say, I think Nadia said this, is when you're at your job, look for that leader that actually you think is inspiring when they talk. And I promise you, they want to be your mentor. I promise you that. We love doing that. It is a part of us being a good leader is mentoring the young. And so it's just a question. You ask, "Hey, can you be my mentor? Can I come and talk to you when I have questions about things that I'm doing, my career path, etc." We'll say yes. We will say yes. I promise you. So yeah, that's the other things that I would like to add with what Nadia and Damien said.
Jeanette, something you just said made me think of something that a student said to me. We were talking about networking, and they said, so what do I say? And you could hear the nervousness, and they're just talking to me. They know me. So they said, "Okay, so what do I say?" I said, "Talk to them like you're talking to me. I know you, Miss Hippolyte. I can talk to you." I said, "But they're just people." So what would you guys advise a student to say to someone maybe that they don't know and they're just going up to, but they know, like, for instance, with Jeanette in the elevator, you knew that's who this guy was. So if I happen to be in a space with someone and I know that's who it is, then what do I do? Or if we're on a college campus and they're tabling on like a career day and I see someone kind of outside of their table, just them, and this is my chance, what do I do then? What do I say?
I can take a stab at that really quickly. My name is Damian Myers. I'm interested in the career in such and such. I know that you are, X, Y, and Z. Can you just tell me a little bit about what your journey? Because I would love to be successful like you one day.
Great.
So you're making them feel validated, and people that are doing well. I mean, Jeanette kind of hit it on it. Like, we look for people to inspire and work with, and we love to see young people that want to learn and have lofty goals and aspirations. Like, we live for that because we see ourselves in them. We were them, a couple of moons ago. And so, it can just be really basic. Like, identify if especially if you already know the position the person has, just what you said earlier, hey, I'm a high school student. I'm not really sure what career path I should take. can you just tell me a little bit about your typical day? And, you know, like it just, once you get that first sentence out and they start talking, they probably won't shut up. They'll start asking you questions. And so the pressure will be off.
Right. I agree with that. Yeah.
He said it all. That's exactly right.
Yeah.
Okay. So now, what about if there are any adults watching that's maybe making a career change? What do you think a good path would be to maybe, let's say I'm leaving college access and now I'm becoming I want to be in the medical field. What would be a good path for me to kind of transition over?
Well, you guys know I do this for a living, so
Well,
what
too,
I would
depends
say,
on your interest, you know, like, I mean, there's so many avenues in the health field. So if you came to me and you said, hey girl, so I want to get into nursing school. What do you think? What should I do? You know, you start exploring nursing schools and you start exploring the programs and, you know, which schools locally have the programs and what are some criteria that's required to get into the program. You know, it's obviously there's a lot of prereqs that you got to do before you actually get into nursing school, but I would take you under my wing.
Thank you.
You're welcome.
Anyone else, anything to add? I know we're coming up on time. We have 9 minutes left. We talked a bit about advice for students watching now. I know we talked about that already. Is there anything that you think that is super important? And before we leave, I want to talk about great entry level for people, because I know you guys mentioned the shortage in healthcare, and I do want to address that before we end this call. Do you have any advice that maybe you didn't share yet that you would like to explain to students watching, be it high school and or college students? What advice would you give them?
Find a mentor is one of them. I would do that. And it doesn't have to necessarily be someone in the career path that you want to go in. Leaders can give you advice on just living, and being a professional in general. Yes, I only work in healthcare, but I've always thought, because I'm operations, and I believe that I could go into other fields and be a good manager of operations in a lot of different fields, just because of what I've learned over my career path. So again, finding a mentor, to that one special mentor that possibly could follow you throughout your career, is essential.
I would say choosing a career is one of the most important decisions that you'll make in your life. And it still baffles me that so many students choose a career path based on what they think they know, based on what they've heard, when they have phones in their hands, iPads by their side, and a computer in front of them. Like, you can literally Google and look up whatever career you think you may want, and then just do a deep dive. You can bring up videos, you can figure out what their day-to-day look like, you know, and so there's so much information at your disposal to make an informed decision. Like, spend the time to really look into it. I know it sounds cool when you tell grandma you want to be an engineer or a doctor, but, you know, put that to the wayside and think about your skill set and what you're good at and what you love and what you're passionate about, and then try to find a career that will match up. And once you find that career, look at the person that has that job, look at their education, look at their experiences, and make sure that every step along the way you're building towards that ultimate goal, with, you know, the expectation it's probably going to change over the course of your life. Very few of us are like Nadia and we're doing exactly what we thought we would be doing as a kid. But if you have those gateway skills, reading, writing, your ability to communicate, your ability to critical think, that will make you successful in whatever field you ultimately choose.
And give yourself grace along the way. Give yourself time. You know, don't be so hard on yourself. You know, I have 2 college-age girls. And, you know, yes, one wants to be a nurse, one is in nursing school, the other one wants to be a forensic psychologist. But, you know, leading up to college, when they were in high school, they kind of wavered a little bit. I don't know if this is what I really want to do. I've been hearing this, and, you know, I've been reading on this, and, you know, I'm a little nervous to take the plunge. And, you know, give yourself grace and time to work the kinks out, and it will eventually just present itself to you. You know, so my daughter she's finally in nursing school, right? But for a minute there, she's like, I don't know if I want to be a nurse, Mom. But now she's like in her clinicals, and she's like, oh, this all makes sense. Like, I feel my purpose, and I feel like, okay, all these micro classes I did, all these anatomy and physiology classes that I did, and trying to learn all the different parts of the body, now it makes sense. Like, I needed to know that stuff in order to really take care of my patients. And now that I'm taking care of my patients, now it's coming full circle. So now I feel like she's kind of like settled in, so to speak, and she feels like she's living in her purpose. So it's okay to not know and have all the pieces of the puzzle right away. You know, and it will eventually work itself out, I promise.
Can I speak to that really quickly?
Sure.
Absolutely.
Because I think one of my biggest regrets is I was not in a space to really allow myself to enjoy the journey. You know, when you're trying to be the first and you feel like the weight of the world, like I'm the first male to graduate from high school in my mom's family in 30 years. I'm from Detroit, where all of my uncles and cousins, older cousins, they went to work in the factory, where with overtime you could live a middle-class life, or they joined the military. And I think I felt so much pressure, like I gotta make it, I gotta make it. I didn't enjoy the journey. And before you know it, like Morehouse is over, which is, you know, it was the best time of my life, quite honestly. But because I was so stressed about trying to become successful and trying to become whatever, I just didn't take the time to develop those long-term relationships and just enjoy every day. It's a journey, it's a marathon. Life is not a sprint. And I wish that I had spent more time just enjoying the small things, especially when I was in college, that you'll never get to experience again.
True.
Absolutely. There's so many more. I have about 3 more questions, but we have 3 more minutes, so I can't do that. Do you guys want to add anything else? I didn't see any questions come over. Cameron, did I miss any questions?
No, not that I saw.
Okay. I think someone asked to expand on, let's say I want to be in the medical field, but I'm bad at science. What should I do? And I'm talking really fast for 2 minutes.
Yeah, I don't know. If you're bad at science, no. Davey can answer that. But the one thing I wanted to say is, you know, in the healthcare field, if you want to do direct patient care, it's not just to be a doctor, to be a nurse. Become a radiologist, or become, I'm sorry, that's a physician. Become a rad tech, a radiology technician. They help with the x-rays, and there's other things that they do if you get advanced certifications. But, you know, that's an example of something that we're in desperate need of across the entire country. And medical assistants as well. It's, you know, there's so many other careers in healthcare that make the hospital operate. Without them, we can't do it. We just can't. So
nobody's poor at science. That is indicative or a marker for something else that's going on. You have poor study skills, poor note-taking skills. You don't know how to study. You don't know how to decode the information. You are not bad at science. Do not beat yourself up. It is a skill that you can be taught, and you need a mentor, a teacher, someone to really sit down with you and tell you how to interact with the curriculum. That's all. No one's bad at science. You can do it.
And on that note, I put the link to your program in the chat. So if anyone's interested, the link's in there if you want more information, because we do have students that say, oh, I want to do this, but I'm poor at this. Another fire round. We have 1 minute. Please tell me some of I hear you guys mention healthcare shortage. What are some entry-level roles that people can apply for, or where should they go to fill these shortages? What's needed? What do you guys need?
Nursing assistants, or like patient care techs, you know. There, if you look on, I believe, Red Cross's website, you can actually start there with trying to get some certifications. And, you know, it's like an entry-level type, you know, job. It's pretty much, emptying Foley's and taking vital signs and, just, and you get an actual look at an everyday running of a floor. If you know what I mean, if you want to be a nurse, you see what the nurses do. You'll actually be able to mentor up with someone there to kind of show you the ropes. But I do know that the Red Cross has some programs, and you can kind of like start there and see where it takes you.
Thank you.
Medical
Damien.
office assistants on the more administrative side, working at front desks in our practices and in the hospital. So medical office assistants. It doesn't require a certification, but if you work for a university, medical university, you'll probably be able to get your school paid for and continue on with your education and have lots of mentors.
Mm-hmm.
Jeanette stole my thunder. My sister-in-law is actually doing that now. She works in administration at a hospital, entry level, but they're paying for her to go back to get her degree. So that's what I was going to say.
Awesome. Look, 4:01. I know I want to respect everyone's time. Thank you, Nadia, Damien, Jeanette. You guys, thank you for your time. For the folks watching, join us again. We're here on the first Wednesday of every month. For you three, if someone wants to reach out to you with questions or follow-up information, are you able to share any information in the chat with the viewers?
Absolutely.
I'm on LinkedIn.
LinkedIn, if you can drop that in the chat as well, please, so they can reach out with questions. And this is another thing I tell this to the students I work with too. Across, like during their times in school and going to events, they meet people who say, here's my card, email me, here's my phone number, call me. And when I ask the people who give these cards and phone numbers, how many people call them? Not many at all. So if you get contact information from people, they want to help you. And I think you guys talked about that. So please reach out if you have questions and they'll be happy to help. Thank you all for your time. Cameron, thank you for being a great co-host. And everyone have a great day. And we'll see you again on the first Wednesday in March. Bye.
Thank you.
Thank you.
Thank you.